May is Mental Health Awareness Month, and today we're focusing on problems that seniors face and resources available to them. Tracy Slager is here with us now, a behavioral health outpatient care manager with Priority Health. Good morning, Tracy.
Good morning.
So what is the importance of holding a Mental Health Awareness Month?
So, this is our time to raise awareness for those living with mental or behavioral health issues and to help reduce the stigma that so many experience. Each year, we're fighting to help reduce that stigma, to provide support and educate the public about mental health and advocate for policies that will support people with mental illness and their families. We also advocate for treatment and to connect people to resources.
So what are some of the mental health issues that seniors are facing?
Yeah, so they face quite a few. This is a population that has changing bodies and chemistry. They have a lot of changes in their family and relationships, their living situations, and these all have an effect on mental health and should be considered in treatment. They have a lot of losses at this age and deep sadness and grief that can linger, and that can signal some clinical depression. They also have anxiety, which, is different from just those normal worries. According to the CDC, it's estimated that about 20% of people 55 years or older are experiencing some type of mental health concerns. Again, this is only what's been reported. Those most common conditions that we see are anxiety, cognitive impairment, and mood disorders such as depression or bipolar. And this really can affect their physical health as well. They're very interconnected.
So what are some of the symptoms we should keep an eye out for?
Yeah, so depression in older adults can be difficult to recognize because they have some different symptoms than our younger adults. For some older adults with depression, sadness isn't their main symptom. They can really, you can see a lack of interest in their activities. They'll show a decrease in energy or motivation. But some of those symptoms to look for can include sadness that does last longer than 2 weeks, constant worries about things such as money, family, health issues, consistent trouble sleeping or concentrating, maybe feeling confused or remembering things. We see a lot of cognitive concerns in this population, and having more than one alcoholic drink a day or taking more medication than prescribed.
Any barriers blocking getting the appropriate care for our seniors?
Yeah, so again, there's this stigma that surrounds the topic of mental health. Historically, this population has not been encouraged to talk about their feelings or the need for mental health help. So that's definitely a barrier we work at here at Priority Health with our members. Other barriers include access to services due to their physical limitations, transportation options, if they don't drive or have access to public transportation, and even just knowing how to access outpatient behavioral health treatment providers can be problematic.
And Tracy, where can people go to learn more about Priority Health and learn some of the resources that you offer?
Yeah, so we have a lot of resources at priorityhealth.com. Our members can also call the behavioral health team. We have a team of fully licensed, master level clinicians that help our members 24 hours a day, 7 days a week. They can access that by calling the number on the back of their member ID card.
Tracy, thank you so much for being here this morning and giving us a little bit of insight. So hopefully we can care for our parents, grandparents, the seniors that we care so much about in our lives.
Yeah, thank you.
Of course.